You might assume your brain is the command center for your mood, but the vast majority of your serotonin, about 90% of it, is actually manufactured in your gut. This creates a frustrating medical paradox. Patients often walk into a clinic dealing with severe brain fog, depressive moods, and a hypersensitivity to chronic pain. Doctors run comprehensive brain scans, looking for the source of the distress, only to find completely normal results. Also often, patients are sent home and told their symptoms are entirely psychosomatic. The traditional medical approach tends to prescribe pharmaceuticals that strictly target the central nervous system, leaving the digestive tract completely out of the equation. We have to stop treating these organs in isolation. The brain and the gut are deeply intertwined, forming a single continuous network known as the Microbiota-Gut-Brain Axis.
Looking at this illustration of the gut-brain axis, you can see how tryptophan and serotonin production in the gut project directly outward to influence anxiety, depression, and other systemic issues. Attempting to resolve mood disorders or cognitive decline by only treating the brain often means treating the wrong organ entirely. This diagram maps the microbiota-gut-brain axis across 4 communication hotlines. Focusing on the far left neural column, gut bacteria produce neurotransmitters like GABA and serotonin. These stimulate the enteric nervous system, sending rapid-fire signals up the vagus nerve directly into your central nervous system. The second hotline relies on metabolism. When gut bacteria digest and ferment the dietary fiber you eat, they release highly protective molecules called short-chain fatty acids, with butyrate being one of the most critical. These fatty acids perform crucial maintenance. They actively tighten the cellular barrier of your gut. From there, they enter the bloodstream and can actually cross the blood-brain barrier to directly calm inflammation inside the brain. If your diet lacks fiber, you effectively unplug these first 2 hotlines. The bacteria starve, fatty acids disappear, and your brain loses its primary supply of calming signals. This leads to the third hotline, the immune system. When protective fatty acids drop too low, the physical lining of the gut weakens, pulling apart and creating microscopic gaps. This is commonly known as a leaky gut. Through those tiny gaps, bacterial endotoxins called LPS escape into the bloodstream. The body detects these toxins and mounts an aggressive immune response, launching inflammatory cytokines that travel straight to the brain. This resulting neuroinflammation triggers what biologists call sickness behavior. It is the physical root cause of sudden brain fog, extreme fatigue, and the desire to socially withdraw. The fourth hotline is the endocrine network. Looking at this diagram, notice the red arrow on the left. Psychological stress activates fight or flight, blocking the gut from releasing GLP-1. Without GLP-1 to transport glucose, the brain starves, drastically impairing cognitive abilities despite normal blood sugar. Chronic stress and leaky gut structurally starve the brain of energy and bathe it in inflammation. We know the gut handles the vast majority of our serotonin production. So how exactly does the body run that assembly line? This flowchart maps the process. Consuming fiber allows microbes to produce short-chain fatty acids, which act as a biological switch. They promote an enzyme that converts dietary tryptophan into serotonin, sending massive, calming vagal signals to stabilize your brain and emotional networks. The standard pharmaceutical approach attempts to manage symptoms with targeted brain medications. Functional medicine, however, treats the biological route by adopting a high-fiber, gut-friendly lifestyle to keep this chemical cascade running smoothly. Mental clarity and chronic pain management begin long before you reach the pharmacy counter. They start by feeding the microbiome, providing your body the raw materials it needs to rescue a misdiagnosed mind.